Paul, how big a problem is diabetes in the UK and globally?
So diabetes is a big problem both globally and in the United Kingdom. Type 2 diabetes is growing exponentially, but type 1 diabetes is also growing. So yes, it's a big global problem.
Can you explain a little bit about what type 1 diabetes is?
So type 1 diabetes, or sometimes termed insulin-dependent diabetes, is when the insulin-producing cells, or islets of Langerhans, which are the clusters of cells making insulin, have been destroyed by a process of the immune system attacking the patient's own islet cells. And this then causes them to have no production of insulin, and therefore they need replacement of insulin in some form or other.
What is islet cell transplantation?
So islet cell transplantation is a process or a treatment in which the islets which have been destroyed in the process of type 1 diabetes are replaced either by using a donor islet, or in the future we hope to be able to use different sources of islets. But essentially, rather than just giving insulin injections, we're actually replacing the cells that have been destroyed. So islet cell transplantation is a minimally invasive treatment in which we actually replace the islets of Langerhans, which are these little clusters of cells within the pancreas that have been destroyed in type 1 diabetes. So rather than then the patient having insulin injections, we're actually enabling them to have full normal production of the insulin that was no longer being produced after they developed the diabetes. Now this has a huge advantage because not only does it mean that we're not just giving a certain number of injections per day or a pump, we're actually replacing the insulin minute to minute in a response to the sugar levels. And in addition to that, we're also producing the other hormones that are produced, which we think are equally important to really get tight glucose control in the patient. And therefore there's big advantages because essentially we know that the tightness of control of diabetes in type 1 is linked to the prevention of the long-term complications. And so that's why we think it's a much more erudite way of truly reversing diabetes rather than just keeping it at bay.
Can you explain a little bit about what the IPITA conference is and why is it important to people working in the field?
So the IPITA conference is held every 2 years. It's an international group of people working, both clinicians and scientists, in the field of whole pancreas transplantation and also islet transplantation. And the importance is it's a very specialised group of people, but it is essentially where the state-of-art science and also clinical results are presented every 2 years. This is the first time it's been held in the United Kingdom, and it's a truly collaborative group of people. And I think what we're going to be hearing over the next few days is the absolutely best and the latest science and clinical results in this field. And therefore it's a very important meeting, and one which I think has not only furthered the field over the last decade, but we hope will also take us into a whole lot of new avenues in the next 10 years, in the next 10 or 20 years.
What are the hopes and realities of people with type 1 diabetes who are going to undergo an islet cell transplant?
The ultimate aim of islet transplantation is to truly reverse diabetes and for the patient not to require insulin at all. But our expectations also have to be realistic, and at the moment, certainly in the UK, our reason for transplanting patients is once they had developed unawareness of their hypos, a very severe condition which a certain number of patients with type 1 after a certain number of years develop. And clearly that's life-threatening, and by replacing the islets, even if we do not get them off insulin, we can nearly always reverse that really debilitating side effect. The ultimate aim is that then for those people to also come off insulin, and we achieve that at the moment in about 58% of patients in the United Kingdom. Obviously with improvements, and that's improvements in techniques, in the number of cells we're using, and ultimately we aim to try and be able to transplant without the need for anti-rejection medication, then of course we can transplant a whole lot of different people that we're not transplanting now, and we hope the results as well will also be that much better. So there's the ultimate aim, and then the current realistic. And I think it's really important we put the perspective right rather than giving false expectations. But over the last decade, islet transplantation has improved so significantly that we now can offer it to a really big group of patients.
What are the limitations to islet cell transplantation, and how many people are waiting for a procedure?
So in the United Kingdom, we're very fortunate because since 2008, the government has funded islet transplantation as a clinical service for patients with life-threatening hypoglycemic unawareness. And we have 3 centres in the country who extract the islets, and we have 7 centres that transplant the islets in a sort of hub and spoke model. There are still many centres around the world, however, where islet transplantation isn't funded, and in that sense it's still a research modality, even though we know it's very successful. So the ultimate aim would be that all around the world, where there is a significant problem with type 1 diabetes, that it is funded for all patients to be able to receive the islets. Now, we are deliberately just now transplanting patients with severe hypos, and we're not fundamentally transplanting all patients with type 1 with the aim of getting them off insulin. Now, that isn't primarily a funding issue, it's just a realistic expectation of what we can routinely achieve. But the ultimate aim would be for it to be available to many, many more people, and the ultimate aim is that it will be available for children. And my role as a paediatric surgeon, I'm a professor of paediatric surgery here in Oxford as well as head of the Islet programme, and the reason I got involved in islets in the first place is this whole drive that ultimately we would like to be able to give a patient, a child, an islet transplant soon after they're diagnosed with the condition. We are away from that at the moment, and the biggest obstacle is the fact that if a patient has an islet transplant, they require long-term anti-rejection medication. And although that is very safe, it is not without its potential problems lifelong. If we can remove that obstacle, and that's really huge areas of our research are concentrating on that, then we have a treatment that we can use for many more people and ultimately children.
Could you talk a little bit about xenotransplantation and the potential it has for giving us more cells that are transplantable?
So one of the limitations of islet transplantation is the islet isolation or the extraction process. And that has two limitations. The actual process itself is fairly inefficient, but also there's a limitation of the number of human organ donors as there is for any type of transplant. Now, the beauty about islet transplantation being a cell transplant is that we think that in the future we'll be able to use alternative sources of islets without requiring a cadaveric or a heart-beating donor. And there's two sources that we're looking at are stem cells and also animal islets, or so-called xenotransplantation. Now, of course, previously we always used to use pig insulin, so it's not very far from where we've been already. But the aim then is that you could potentially have a renewable source of islets, a constant source of islets from an animal product, probably pigs is the most likely. And there's a lot of very good research and lots of very good advances in that area. And it may well be a realistic treatment in the coming years. So that is the two approaches, a stem cell approach or a xenogenetic approach. And teams are working equally hard on both those modalities.
Can you explain a little bit about the DRWF-funded islet isolation laboratory here in Oxford, and also how that supports research in other parts of the country and other parts of the world?
DRWF have been absolutely key in the development of islet transplantation here in Oxford, in the United Kingdom, in a number of centres across Europe and further afield. Their ongoing support is absolutely critical, and we look forward to partnering with them for many years to come.